The diagnostic centers has, I think, a paramount impact on delivery of healthcare. The healthcare system today is actually a system which is strained, and it is not strained only because of lack of staff, but it's strained in terms of process. I think diagnostic centers have a paramount impact on how we can actually reduce the pressure on the secondary and tertiary care by actually enlarging and making care available at the local scene, at the local community of high quality. That will offload the hospital system, make the quality improve, and make patient and staff satisfaction increase. One of the key issues in modern healthcare today and in a modern healthcare system is actually not only the accessibility, but it's also to actually make use of modern technology to its absolute pinnacle. And to do that, you need a couple of key ingredients, and I think those are really present in here. We're looking not only to reduce the cost of care, but also to improve the quality of care. But we have two key persons in here. There's actually the staff satisfaction, the ability to retain staff, train staff to execute at the absolute best is key. But the same thing goes for the patient. Patient comfort, patient centricity is also key, not only for the well-being of the patient, but actually the absolute best diagnostics out of it. So I think all of those things comes together in this unique composition that we have here at the Rutherford Diagnostics. So if I would look internationally in my role and what I see, this is actually one of the most advanced, actually one of the best institutions I've seen. And the interesting thing about Rutherford Diagnostics is that there is no legacy. We've been able from the start to actually deploy absolutely the latest and the best in technology. And technology today is not technology for technology's sake. It has a paramount impact on the quality and how diagnostics performs. You have state-of-the-art in the imaging space, so to speak, around what we call magnetic resonance tomography, around CT, etc. But you also have an IT backbone and a way to actually get data, really KPI-driven approach to healthcare, which is, I think, the fundamental need to drive healthcare in the future. So if I look at this center here today, it's absolutely the latest and the greatest of what actually is available in technology today. The role that actually Philips had with Rutherford was a long time carved back in 2016. It all started actually with the transition of Philips becoming a 100% healthcare technology company. And we were approached by the founding fathers of Rutherford to actually contemplate over an idea of setting up cancer centers in the UK. And state-of-the-art cancer centers, which we actually warmed very much to because it was completely in line with the way we see we need to transition in healthcare by actually onboarding very strong entrepreneurs in order to actually address some of the key issues we have in healthcare today. Now, the collaboration actually then evolved and morphed into what we call today Rutherford Diagnostics, because as we progressed with the cancer centers, it was pretty obvious to us we saw the need for enhanced and additional diagnostic capabilities. At the same time then, we learned to know each other, and I think the relationship deepened. We put a second tranche of investment into the partnership together with Rutherford Health. And I say today, I'm extremely proud to see the outcome of that partnership. Not only through the quality, through the way the partnership have evolved, but if you look at the outcome, in record time to be able to put 4 extremely advanced cancer centers, in record time to put up this extraordinary community diagnostic center is unprecedented. So we are extremely happy and proud to be a part of this.